The purpose of our California Pituitary Conference is really to educate physicians about the diagnosis and the management, both surgical and medical, as well as radiation for pituitary adenomas and related tumors.
This is a wonderful conference, and I think it's so important that we have these conferences because this is a disease, pituitary tumors, that are often very difficult to diagnose, that are very specific tumors that need the proper teamwork, and I think patients and the medical community need this education to treat them effectively.
A pituitary tumor is not just a hormone problem. Sometimes it's a vision problem, sometimes it's a neurologic problem, sometimes it's a mood disturbance. And by bringing all of the specialists together at periodic conferences where we include physicians of a wide breadth of specialty, as well as patients who can tell us their own story about how they have dealt with their pituitary tumors, allows all of us to do a much better job of learning how to take better care of our patients and advancing the technology and the science of pituitary disease and its management.
The California Pituitary Conference is therefore aimed at this population. It's a full day, very extensive symposium on the medical management, surgical management, as well as radiotherapy.
The beauty of this type of conference is that you have various speakers who have differing and contemporary interests and knowledge on this field. For example, I am very involved in developing consensus guidelines for the treatment of pituitary diseases. In fact, I'm currently writing several of these as we speak. And this conference gives me an opportunity to disseminate this information to other physicians and patients.
As you all know, pituitary disorders are very, very complex and challenging. In the past year, there have been 2 new approved medications to treat Cushing's disease, and my presentation today is going to provide an overview of those 2 treatments. These are 2 new medications that have been approved for treating people who have Cushing's disease, whose disease has not fully been treated and brought into remission by surgery and other techniques.
Today I had a small session to talk about prolactinoma. I was privileged to talk about symptoms of the disease and mostly focus on the treatment options for some of these kind of patients.
We welcome physicians from around the world to come to our conferences and learn about the latest treatments for patients with pituitary disorders.